How does a person know that they have a mental or behavioral health problem? And how does a person choose between seeking therapy versus something like life coaching? Hello, my name is John, the Millennial Therapist. Today, I'm going to talk about how therapists typically define impairment and dysfunction, and the objective lens that is most frequently used and should be used to frame that impairment. I will be using impairment and dysfunction interchangeably in this video, so keep that in mind. And by the end of it, those watching should be able to identify what therapy is best used for and how it distinguishes between mere life coaching and actual behavioral health related issues. Despite what social media and popular culture would have you believe, mental health diagnoses and conditions are actually fairly well defined and identified and categorized through a series of mostly well thought out and deeply considered criteria. Now, I don't want to get into the politics of this, and there are both political and cultural influences in the diagnostic process in America and in the West, anywhere really, but for the most part, these factors notwithstanding, most of these diagnoses and their criteria represent a good faith effort by the professionals and experts to meaningfully define and designate what is what and advise on treatment. Okay, not always perfect, but there is by and large a good faith effort here. So, when does a person know he has a behavioral health or a mental health problem, making him a candidate for treatment? If a person is experiencing what many providers would call clinically significant symptoms, they might require therapy or even medication management in addition. What are clinically significant symptoms? These are symptoms that meaningfully, which is to say materially, impair a person's day to day functioning. This means there is evidence in the person's life that demonstrate the impaired functioning. In other words, the dysfunction is sufficient to produce fallout, which could be physical, social, financial, or cognitive behavioral, which is just a fancy way of saying how a person thinks and behaves. But okay, obviously there has to be something wrong, otherwise, why go to a therapist or psychiatrist? How dysfunction is defined is the real crux of the issue here. After all, what one culture or person thinks is bad might be good in another's. In American psychological and psychiatric treatment, impairment is defined by measurable outcomes, not opinions, moral or otherwise, at least in spirit. A person is impaired when elements of his life are in clear objective decline as a result of his mental and behavioral status. Some of the common life elements examined include ones, as mentioned before, social life and relationships, financial state, physical health, employment, and hygiene. If a person is being fired repeatedly, making it difficult for them to maintain a job, it could be a sign that he is coping poorly with stress, resulting in the cognitive behavioral impairment that leads to the frequent termination. If a person is struggling in most or all of her relationships, the same could be assumed there. In essence, that it is the person's way of thinking and behaving that is the core problem. Cognitive behavioral is an adjective I frequently use and will continue to use here. It refers to a person's thought process and the related behaviors. Basically, you have the thoughts and then there are the behaviors that follow, and vice versa. It is my catch-all term for a person's combined thought and action patterns. Let's work with a diagnostic example. Consider a substance use disorder. How do we know, for example, from a clinician's perspective, that a person is likely abusing or addicted to alcohol? Is it, excuse me, frequency of drinking? How many they have in a weekend or a day? Not really. Those things might correlate with problems that are likely to arise, but they are not even close to being the main criteria. In order to diagnose a substance use disorder in the United States utilizing the DSM-5, which is the diagnostic manual and standard, a person has to meet fairly specific criteria. There has to be identifiable dysfunction that is provable and measurable. Let's imagine two different drinkers. One person drinks almost daily, say a few glasses of wine a night, but has no mental, physical, financial, legal, or social problems at this time. It would be very difficult to diagnose that person as having a substance use issue because there doesn't seem to be any. Where's the problem? You can't just base it on feels or cultural and personal preference, or at least you're not supposed to. The other person, however, drinks only on the weekend, maybe one weekend a month, but when he drinks, he binges. In binging, he often wrecks his car, resulting in frequent legal and financial trouble. On top of that, his excessive drinking leads to poor sleep and impaired work performance due to the hangovers. Moreover, he is frequently in fights at bars and becomes irascible with friends and family, damaging relationships. So even though this person only drinks once a month, when he does, it results in a slew of measurable and evidenced dysfunction. The latter person would likely be diagnosable with a severe substance use condition, not because of feelings, culture, or even number of drinks, but because of the materially and objectively identifiable impairment the drinking behaviors cause. This is how we identify and define dysfunction and clinically significant impairment in symptoms broadly. While therapy is for dealing with thoughts and behaviors that are causing day to day life impairments, as I said, that are clearly evidenced, life coaching, on the other hand, has to do with thoughts and behaviors that are not causing day to day life impairments. One might feel held back or that he or she is not meeting expected potential, but lack of optimization or not excelling or even just being or feeling average is not the same as a cognitive behavior that results in a materially evidenced worsening life situation. Summed up, therapy is for people who are failing to functionally adapt to their circumstances. Life coaching is for functioning people who wish to meet their fullest potential in a given area. Well, that is all the news that is fit to print. To learn more about the kinds of mental health providers there are and the differences, check out my next video. Thanks for listening, and don't forget to like and subscribe. Thank you.